Patient is brought to the emergency department following a motor vehicle collision. He has an injury over the thigh. On examination, he's having tachycardia. His BP is okay, kind of normal. Respiratory rate little bit increased. He is anxious but oriented, means there is no neurological problem. What type of hemorrhage does this describe best? So when we study hemorrhage, hemorrhage is given 4 classes based on the quantity of blood loss. If the amount of blood loss is less than 15% of total blood volume, it is 15 to 30% of total blood volume. It is 31 to 40% of total blood volume, or more than 40%. These are the 4 types of shocks, hemorrhages. So more the hemorrhage, obviously more marked will be the findings. In class 1 hemorrhage, less than 15%, see less than 15% can be 0% also. So when the blood loss volume is less than 15% or approximately in an adult, if it's less than 750 ml, there are no findings, which is so strange. So understand, as a post-op patient with hemorrhage, even if he has lost 400-500 ml of blood, he will not have any clinical findings. Clinical findings develop when it is between 15 to 30%, where the first finding that you get is tachycardia. So in a normally physiological state, only when the blood loss crosses 15 to 30% is when you get tachycardia, and urine output, everything is usually going to be intact. In class 3 hemorrhage, the tachycardia will be more. He starts getting polyuria. He starts getting hypotension. So understand, if your patient is having hypotension due to hemorrhage, he is in class 3. Class 4, everything will get much worse. He'll have profound hypotension, anuria, he may be unconscious, or he may die, right? So that is going to be class 4 hemorrhage. So now see the scenario, there is only tachycardia. It means it is a class 2 hemorrhage. Right, it is a class 2 hemorrhage. This is the table, it's there in Bailey. I have just simplified it and put all the facts that we discussed, where you are going to see the amount of blood loss, and the first place where you get tachycardia is class 2 hemorrhage. Hypotension, oliguria comes in class 3 hemorrhage. And a very bad mental state, unconsciousness, profound hypotension, refractory hypotension is going to be class 4 hemorrhage based on the quantity of blood loss, right? Very important table. You must know this because it's like a, low-hanging fruit. You cannot make a mistake in these kind of questions.